All right, you guys, for this lunch and learn, I would like to introduce Dr. Carly Causey. And I've known Carly for a long time. We actually used to work together in the same clinic, and we both stand around 5'7", 5'8"-ish. We have blonde hair and both love Lululemon. So we actually used to have a lot of our patients maybe get us confused as we went by our first names. And I'm really excited to have Dr. Carly join us because she's really dove into the pregnant postpartum realm, really for the active female. And that's super exciting for me as a coach and a doctor of active females. And so I'm going to turn it over to her and continue to let her do the introduction. Dr. Carly.
Yeah, thank you. I'm excited to be here, you guys. Thanks for listening in advance, I guess. So I'm here. I'm in Seattle, Washington right now. And I have a clinic here called Seattle Sports Chiropractic. I'll do a little bit about me here. I'm in my 11th year in practice as a sports chiropractor. And like Dr. Carla was saying, I've had a lot of additional training these last couple of years, last 4 or 5 years or so, in kind of the postpartum, perinatal, kind of all around the birth process. And so, yeah, I've just really dove into that especially with the active patients. So we see a really active population. I started my practice in a CrossFit gym. So you can imagine, as I'm sure many of you know, that population wants to stay moving and wants to stay moving safely. And so there's a lot of questions around it. And there's a lot of kind of old school ways of thinking about it. But my goal is to kind of bring the research of what pregnant people can do, things that maybe are better to be doing during pregnancy as far as athleticism, things that maybe are not quite worth it during that time frame. And that's kind of my goal. So for a while before COVID, I was teaching a lot of classes. I was doing a class for CrossFit coaches and personal trainers about coaching the pregnant athlete. And that was really fun and felt really rewarding. And then, obviously that all got taken away, but hopefully it's coming back soon. And yeah, it's just been fun to do all this additional training, additional certifications, and learn so much about this population. So here is my son. My son's just over 2 years old, and I'm actually pregnant with my second son, who will be born hopefully in 8 to 10 weeks and not sooner. So I have 2 little boys. Here's a picture just of me in a competition, obviously before I was pregnant, and then with my son Blaze at about 25 weeks, I think. I need to take that picture again so I can put it side by side. Now I'm at 30 weeks. So it's going to be a little different this time around. But so I've been very active also in the gym as a coach. I've been a CrossFit coach for just about 10 years now also. So, okay, I like to show this picture just because it shows us the different layers of the abdominal muscles. And it's a good reminder, especially for those of us that aren't living in this world every day, that when we talk about our core, which we'll talk about more in a minute, it doesn't just consist of these ab muscles, but there are different layers. You can see that they're all coming kind of at different angles. And that's important to remember. I always like people, especially after they've had a baby and we're working on healing the diastasis, which is that separation of the abs. When we're working on strengthening the low backs, getting the glutes firing again, all these things that we have to do. I just it's so nice to have a picture in your mind's eye of okay, these are my rectus muscles. When we talk about the transverse abdominis, which is a big buzzword in the perinatal world, I want my patients and my athletes to know how the fibers of those muscles look. And so I just kind of like to do a little anatomy review. So for our purposes today, we're going to think of our core kind of as a barrel. Okay. So we have the top, the bottom, and then kind of all the way around. The top is going to be the diaphragm, okay, where you basically the muscle that helps you breathe, right? So that's the top, and the bottom is going to be the pelvic floor, okay? In a minute, I'm going to show a diagram of how those kind of work together as we breathe and how we can use this barrel, this kind of barrel of our core, to stabilize our spine, to help us heal after having a baby, and really how we should be breathing when we're weightlifting in general, but especially postpartum and during pregnancy. So, okay, so we have our diaphragm, we have our pelvic floor, but then we have our transverse abdominis, our other ab muscles kind of wrapping around the front, and then we have all our low back muscles. So we don't need to get too much more specific than that in this instance, but just thinking about core, and I like to remind people that core, especially in this case, we need to remember includes the pelvic floor, includes the low back muscles, includes the glutes. Like, we're not just talking about the abs, even though that's what so many people get caught up on when we're talking about healing after giving birth. We get so concerned about our abs, but that's sort of like a little drop in the hat of like what really needs to get fixed. So here we're going to talk about piston breathing, and I'll play this little video. So this is just showing basically how the diaphragm and the pelvic floor move together. So as we breathe in, right, the lungs fill with air. So everything is going to move down. And as we breathe out, we're pushing that breath back up. And so everything moves up. So the pelvic floor and the diaphragm are moving naturally in this way, just as we breathe normally. So we can use this type of movement when we're talking about being active, about squatting, pressing, deadlifting, doing anything that's going to exert pressure, especially during pregnancy, because you can imagine there's already extra weight pushing down on the pelvic floor. Obviously, you got the baby, you got like a couple extra pounds of blood, which isn't that crazy? A couple extra pounds of blood during pregnancy, it's like 3 pounds. You have the placenta, you just have all this additional weight bearing down on the pelvic floor. So anything that we can do to take pressure off that pelvic floor is going to be really important. So as a side note, as I was mentioning earlier, this is actually how we should be breathing when we're lifting weights anyways, but we just don't necessarily think about it in this terminology or for this reason, right? To take pressure off the pelvic floor. So for piston breathing, and again, you can totally teach this to if you're coaching a class, you can totally teach this to everyone. It doesn't have to be limited to the pregnant patient, but just a little additionally important for them. The way I describe it to athletes is you want to breathe out during the hardest part of the movement, okay? If you understand biomechanics, you know that's not actually true. The hardest part of the movement is the eccentric load. But for our purposes, it's really where the athlete feels like it's hardest, like where they're going to be bearing down the most on that pelvic floor. So for an example, for a squat, it would be at the bottom of the squat. So you'd have your athlete start at the top, take their breath in. Right as they hit the bottom of that squat, they're going to aggressively breathe out. And that's going to cause a contraction of the pelvic floor to just lift up a little bit. It's using the natural rhythm of that breath that I just showed you. But it's going to help not bear down extra weight onto a pelvic floor that already has extra weight bearing down on it. Then you've got a barbell on your back or your front or whatever you've got, additional weight. So we're just trying to limit the increased strain on that pelvic floor. Does that make sense so far? Cool. With pressing, it would be the same thing. Okay. So you have your barbell here, you take your breath in, right as you hit the top of that press, that's where you're going to breathe out. Okay. You can also breathe out in and out through the movement. So especially during pregnancy, we don't want our athletes like holding their breath and doing that bear down Valsalva move that we do so much in weightlifting. We don't want that necessarily. So it can be a breathing like process, but you really want that kind of aggressive breath out at that really hard part of the movement.
Question, Carly.
Yes, ma'am.
And I know we've talked a little bit outside of the pregnancy realm, but is this something you teach people with like low back issues too? And as long as they're not under like you can't lift necessarily as heavy of loads, piston breathing?
Totally. Yeah. Yeah. That's a great question. Yeah. It's really interesting if you have people try this, especially if like they're having pain with squatting, for example, with low back pain. what they'll feel is, well, you cue a couple things. You cue this. You also are going to cue kind of a little bit of a contraction of the pelvic floor. So not like when we say Kegel, people get a lot of different ideas in their mind. I like to have people think of just like lifting up just a little bit if they can. If you combine those two things together and you watch someone squat who has low back pain, almost always, as you know, you'll see a difference in the way that they move, and they'll feel a difference in the stability that they feel. It also really helps, I'll show you my big pregnant belly here, but it also really helps, when people are having low back pain and they're squatting, if they do that breath and the lift, they almost always don't end up doing this whole kind of like booty pop back, which, as you know, can often be a cause of like why it hurts during squatting. So they'll stabilize their pelvis and their spine better in general.
Cool. Thank you.
Yeah. So a lot of questions I get about pregnancy are, what core work can I do? It's pretty standard. I'm so happy that, the last couple of years, social media and all this stuff, for all its evils, one of the good things it's done is bring active pregnant women to light, like Carla, like myself, like a lot of the CrossFit Games athletes and these like, professional soccer players, it's like amazing, tennis players, basketball, it's awesome. And so I love that. And it's also brought to light like some of the stuff you maybe shouldn't be doing during pregnancy and some of the stuff that might be more beneficial. So I always tell my athletes and patients that you should for sure be doing core work. It's just a matter of picking the right kind of core work. Okay. So as a general rule, when we're coaching pregnant athletes, we are going to have them avoid crunches or sit-ups. Okay. We're going to have them avoid toes to bar. Honestly, a lot of hanging movements in general. The reason being, we'll talk about diastasis in a minute, is that they lose control as those abs start to stretch and expand. They lose control of their core right down the center, called their linea alba of their abs. And so what you'll see is a coning or doming coming out in that region. And I have a picture here in a minute I'll show. But basically, that's kind of my general rule, is that if you're getting that coning or doming, it means you're not controlling the pressure of your core, and it's just going to make it harder to recover later. So it doesn't necessarily, you're not hurting yourself, you're not hurting the baby, but it can make it a lot harder for us to get your core back into a stable, functioning position once the baby comes out. And so that's kind of the reason why. So that's what we're looking to avoid. And it can also happen with other movements in the gym. So pressing, strict movements eventually sometimes will go for some women. So we can have people move into like dumbbells are always a little more forgiving, right? So we can have them move into more dumbbell movements. Anything really, though, that you see, and you can ask your athletes, you can tell them about this, and then you can have them either film themselves, to see if it's happening, because they can't always feel it. You can look for them if they're comfortable, pulling their shirt up. A lot of CrossFit athletes are like, pulling shirt up all the time anyways. So taking their shirt off anyways. So if they're comfortable with you looking at their abdomen, or they can have, a partner or a workout buddy or friend or whatever, they can just kind of explain, like, do you see like a little bit of a cone happening here? And if so, then let's pick a different exercise. So, okay, that was my rant, but let's talk about what we can do. So one of the ones that I love to have pregnant women do is the Pallof Press. So this picture is kind of funny, but you guys know a Pallof Press, this band is supposed to be going out to the side of her. So she's pressing right out from her chest. Variations of that, right? She could be standing, she could be half kneeling, she's tall kneeling. We could have her, do some resisted with a little bit of rotation. We could have her do just some rotation. There's lots of different ways to do that. But what we want to think about here is reminding her we're also going to be using that breathing technique. Okay. So it's going to take pressure off the pelvic floor, but as she does that breathing out, so if she's doing a Pallof press, she would breathe in and breathe out. As she presses out, she's going to be able to kind of wrap her abdominal muscles together a little bit better. And that will help her to not let that pressure come out through the front, but B, she's actually working all around her abdomen in a little bit different way than if she was just, pressing and not working with the breath too. So that breathing piece is super important during pregnancy and afterwards. And it's one of the things that, like, before I got into this world, I was a little bit like, oh man, breathing, it's so boring. Like, it's so slow. I don't want to do it with my patients. But the more you get into it, the more you see that it's like, it's the ticket, And so when you're working with a pregnant athlete, that breathing piece, if you get nothing else out of this, like, I hope that's what you would learn, and maybe even delve a little more into, because that's what really helps the recovery and what helps, like, not make things a little bit harder during the pregnant phase. Side planks from the knees. Most women, generally speaking, can do these pretty far into pregnancy, just because of the way it's using the abdominal muscles and not putting so much strain through the rectus. Couple different options. You can have them hold. You can have them do almost like a hip hinge. So they kind of sit their butt back into an L shape and then press their hips up back forward. So they're doing more of like reps. I always just like to come up with options for pregnant people, because you feel like as you get bigger and bigger and bigger, things keep getting taken away from you. So the more options you can give them, the better. Even if we're talking about a squat, like, start getting creative with, like, okay, you have your back squat, you have your front squat. You can do like a single arm kettlebell squat instead of just a goblet squat. Just like mixing it up really helps, so they don't feel like all they're doing is like squats and lunges and, like, I don't know, like dumbbell presses. So that's a good one. Side planks from the knees. Not necessarily, even if they can do them from the feet, I usually have them switch to the knees, I don't know, somewhere around late second trimester, just because you're decreasing the leverage. And again, we want to think about, like, is it worth it? Is it worth it to get that extra little bit? Usually not. Sometimes maybe. Obviously, I don't want to ever speak in definitives, but generally we want to shorten that lever so that we can focus just on their the pieces of core that we're trying to affect. Kettlebell windmills are great. So I like to remind people that core work is not just like sit-ups and toes to bar and GHDs, but anything where we're stabilizing is core work, right? So low back holds on the GHD are awesome for pregnant women. I have almost every pregnant patient in my office doing them, because it's going to help stabilize their spine, which is going to help stabilize their pelvis, which is like moving all over the place from hormones. So think about that. I didn't add that in here as one of my slides, but that's like probably numero uno, actually. But then any of the kettlebell, dumbbell, kind of isolation or isometric holds are also going to be really great. Windmills, again, you're stabilizing through obviously your abdominal muscles, but you're also hip hinging. And so you're using your back and your glutes as well. And then again, so many of the carries, right? So farmer's carries, awesome. Almost always no problems. You can do, a front rack carry with a suitcase carry, just a suitcase carry, just a front rack carry. The waiters walk overhead. You just want to make sure that you're cueing your athletes just to make sure they're not, well, all your athletes, right? You want to make sure they're all not overextending, but especially during this time, that would be one of the things that could put additional strain through the abs. But even just a lightweight, or you could do a bottoms up hold to do some shoulder stabilization. There's just a lot of options. So I like to encourage, especially coaches, to get creative with this kind of stuff. If you're coaching an athlete in class and, there's an abdominal movement and you want to sub one of these things, don't be afraid to, like, change the whole workout basically, right? Especially if it's like a quick burner. Sorry, but a pregnant woman can't redline and shouldn't redline. So we can make the workout longer and still get her heart rate up, still get her a great workout, but we could add in like maybe a minute of farmer's carries for her core work, where everyone else is doing like 15 sit-ups. It's not going to take them a minute, but it's going to get her a good workout also. Any questions on that? Pretty good. Okay, let's talk a bit more about diastasis. So as I mentioned, diastasis, if you're not familiar with it, is just the separation of the abdominal wall here. You can see in the picture kind of how that happens. It has to happen, right? Like for most people, I mean, some studies show up to 100% of people have some form of diastasis during their pregnancy. Like the abs stretch, like they got to go somewhere. So I always like to remind people it's super normal, it's super natural for this to happen. What we're trying to do is just avoid making it harder to recover after. Okay. And so that's what we're looking for. So this is what diastasis is basically, but for our purposes here, it's most important to know that like it's normal, it's going to happen. And then the recovery postpartum, you don't even worry about this as far as like rehabbing it during pregnancy because you can't. You just worry about not making it worse afterwards, after baby comes out. That's when we start working on the recovery.
I will say one thing. I have had a couple professional beach volleyball players who are like 6'3", 6'4" with super long torsos. I think they're the only people who like barely get any because they have so much other room for this baby to go. And I'm just like, wouldn't that be so special and nice?
Yeah. Wouldn't that be nice? Yeah. I mean, of course, there's always anomalies, right? But like generally speaking, and I should mention, I always like to mention this, it's not just pregnant people who get diastasis. So anyone can have a diastasis. And so it's sort of good to check and like see on yourself. Also, I also like to make sure people always realize that like it's not the end of the world if you have it. Like it's more about function. And so what we're trying to do when we talk about some of these breathing things is we're talking about functionally creating tension and closing the gap, but functionally, not necessarily that our muscles are coming completely back together. It doesn't always happen, but that's where the breathing and bracing comes in later, that we create that tension. So if you have a diastasis, it is not the end of the world. There's plenty of amazing athletes who have diastasis. As far as coning, so I mentioned that earlier, you can see here, I really like this picture. This is Kiana Welch. She's a world-class weightlifter. This is her first pregnancy like a couple years ago, but she's demonstrating here what that coning looks like. And so you can see with her kip how that pressure out through the front. It's not always quite this obvious, but you can see what that coning or doming looks like. So same thing here. You can see this line right here pressing out. I have this picture in here because this is actually, you know, if you're a coach or if you're an athlete, like it might not be as easy to like feel someone's diastasis as it would if like you're in the office seeing Carla or I, for example. But you have to be careful because sometimes in certain movements, it's just skin, right? There's a lot of skin left. And so you have to, if you're a doctor, you can feel that and see like, okay, actually like you're getting pretty good control there. It's just you have extra skin. Like, all right, no big deal. But so I just always mention that you want to be sure, you want to be careful about this. But this is, again, I'll mention during pregnancy, and these are looking at that diastasis in postpartum. So kind of two different scenarios, but I think it's important to be able to recognize this in your athletes, pregnant or not. If they're losing control like this, they need to take their movement back a notch and work on controlling that intra-abdominal pressure before they progress. So there's a lot of different diastasis recovery exercises. These are, excuse me, some of the ones that I start with. We're not going to go through these specifically, but you can always reach out to me. We have videos of these on our site, or research them. But we start with breathing exercises always. Carla, I just realized I didn't plug in my computer. Let me grab my power cord super quick because I'm afraid it's going to die.
Sounds good. While she's grabbing her power cord, I will say that after my first child, I did do a lot of these exercises that Dr. Carly gave me guidance on, and I did her first 4 or 5 weeks, I can't remember, of her restoration plan. And that was after a C-section as well. So these are all very, very helpful. And for athletes, like I wanted to do something immediately after I had a baby, and Carly's like, breathe. So I was just saying how I had basically worked with you, chatted with you, did the initial phase of like the restoration plan. And I was like, okay,
Yeah.
well, I can't really do much after a C-section, but I can breathe.
Really. Yeah. And it's so, I maybe you were just mentioning this, but it's so valuable to like feel like you can do something, you know, like you go from having this like workout plan that you do all the time and like you have like however much time a day, and then you're like, now I do nothing. Like I can't do nothing. And like sometimes you can't even walk yet, you know, like I have patients that like it's uncomfortable to walk, but they can lay on their back and like focus on their breathing, and just having that like 10 minutes of work to do is like, oh, just like mentally and physically, it's a very valuable. So yeah, these are some of the things we start with. Breathing exercises, obviously, just learning how to re-engage the transverse abdominis, which is the big abdominal muscle that kind of wraps around the belly. Heel slides, these are all just ways that we're basically retraining our body, that our limbs can move while we breathe and we can stabilize through our core. And then these are just progressions, marching and single leg fallouts. So if anyone has questions on those, I'm happy to talk about those another time if you want to message me or whatever. Again, another question I get really often is about planks. Are planks safe during pregnancy? Just like everything, basically, it depends. Lots of women can do planks, you know, into the second trimester. Then we can modify them, you know, we can put them on a box. I don't usually go a lot to the knees. I usually go to a box, but you'll notice in this picture, I always like to point this out. You notice how her butt is up in the air a little bit more. The reason we tell people to keep their butts down, right, is because it works their core. So in this case, if we have them lift their butt up a little bit, she can still work her shoulders, work some of her abdominal muscles, but she's not going to put that strain right down the center of her abs. So that's one way I'll have people do either planks farther into pregnancy or even do burpees. We'll have them go, you know, down to a box maybe, but keep their butt elevated just a little bit. And that way they can get the press through the chest. They can get a range of motion, but they're not really straining as they push up out of that, because their butt is hinging a little and taking away some of that pressure. So that's one thing that people don't often think about, that like, oh yeah, that's why we tell people to keep their butt down, you know, on planks and stuff. In this case, we can actually have them lift it up and it can be beneficial for them. Real quick, I just included a couple weeks, like Carla was mentioning, of my postpartum plan. You can see here, like, this is not a workout, right? This is rehab, but it's something. And I do have people start it. I started 1 week after I gave birth. The first couple weeks I can have people start this, because as you can see, it's stuff that like is not going to be dangerous or impossible to do right after giving birth. And then it progresses. It's an 8-week plan, progresses into some more, you know, little more movement based goblet squats, throughout Pallof Press, that sort of stuff again. But if anyone has any questions about that, my website is here. I'm also on Instagram. I answer my messages and all that at Dr. Carly. And I'm happy to answer any questions. If you have anyone that you know, would like to connect me with, I'm happy to do that too. So please reach out, and thank you for listening.
I always have questions.
Oh, yeah.
I'll be aware of your time though. So this is a question that my coaches always ask me, and I am curious to know, but if you have a very hard charging, stubborn female who really, really is beyond doing a certain movement, but insists that they still do it.
Yeah.
How do you approach that?
Yeah. That's a good question. You know, I think we're all adults, and so we all make our own decisions about what we do. I personally like to present some of this research and just say, you know, this is a cost benefit analysis situation. So you can do this now. Great. I'm so glad you can do bar muscle ups at 20 weeks pregnant. I don't know that the strain that you're putting on your shoulders, because your shoulders are much looser now than they were 20 weeks ago. The strain you're putting on your abdominals as you're coming through in that kip, and the risk of being high up on a bar. And, most of us don't fall off a bar on bar muscle ups, but I know people that it's happened to. I don't know if like those costs or those benefit, I don't know if those risks are worth it, I guess. I don't know if it's worth it that you're going to have a harder recovery potentially afterwards. So I don't like to fear monger at all, but those are the facts, like those are the risks. So, so that's kind of how I approach it. It's cost benefit analysis. So, it really depends where they're at during their pregnancy too. It's during the first trimester. Okay. My first pregnancy, I did the open and there was a bunch of bar muscle ups and I did them because I was like 10 weeks pregnant. I was like, nothing's changed. But I weighed that risk, right? Like I knew like I'm only 10 weeks. I might have said 10 months. I'm only 10 weeks pregnant. It was my first pregnancy, so things don't progress as quickly. I really wanted to do the open, like there's cost benefit analysis. Had I been much farther, I wouldn't have done that, so that's how I approach it.
Yeah. And I don't even remember who told me this, but I think hi buddy, somebody once said, hey, like, can you do that? And should you do that?
Totally.
I think a lot of times, that's my little guy. I think a lot of times, that was a really good question being an athlete. Like, yeah, there were a lot of things I could do. Should I? And, it's super interesting female to female. We talk about coning. Like I coned hanging from a bar very early.
Yeah.
When I always talk with our coaches, like you should see a Buddha belly. Like it should be a Buddha. It shouldn't be coming at you. Right. Like, so we talk when we train our coaching staff. But like doing a plank I was completely Buddha'd, but I do think I have put my hips up. But then I had another female who literally she was on the bar way later than I was.
Yeah.
Competitive athlete, but she couldn't plank for the life of her.
Yeah.
So it's very interesting to see how different bodies like react to the, seemingly same thing. And I'm sure also now in your second pregnancy, we also see differences in pregnancies with women.
Totally. Yeah. I mean, the second pregnancy, I'm experiencing it for myself now, but I always tell people like things just happen faster. Like you get bigger faster. Usually movements go away a little quicker, stuff that you could do your first pregnancy. You're like, oh man, like I can't do that yet already, And so everybody's different. Every pregnancy is different. You're right. Like some people can do certain movements for much longer. And some people are like, nope, that's gone super early. Running, as an example, there's women who are running, the day they give birth, right? And they're like, are people who are running like first trimester, it's already starting to bother their pelvic floor. So we have them stop, and bike or row or same rowing. Some people can't, it's all, it really is up to the person. And so it's like having that open line of communication with your athletes, with your patients, with your whoever it is to, know that like there's nothing really off limits, but there's also nothing that like is definitely going to be okay. It's like a moving target always.
Yeah. That running one. I think we'll also sub in a lot of like sled drags.
Yeah. Yes. Yes. I didn't mention that, but yeah, sled drags, sled pushes, amazing. I wish everyone could do them during pregnancy because it, it's an awesome way to still be working, using your muscles, getting some cardio, like totally safe in general.
One more, it was on your Instagram a week or so ago, but I think you're still doing some box jumps, right? Like, yeah. I'm sure there's people like, what? And you like, you're a jumper. You were a very high level volleyball player, like jumping is your thing. And I've known that of you. And I really liked in your post that says, like, do I need to be jumping? No, I don't, but I love it. And I'm really good at it. And I'm getting near the end and I'm just going to enjoy it.
Yeah.
Until I decide, no, I'm not going to do that anymore. And I think that's like, it's good because you're getting that balance of like, this is something I truly enjoy to do. You obviously have the knowledge of knowing like, hey, I'm not disrupting my pelvic floor because you actually know what that feels like.
Yeah.
And then to be able to say, Yep, we're about near the end. And I love that you posted and wrote about that.
Yeah, thank you. Yeah, I think, like you said, there's like, everything we do is this cost benefit analysis again, right? So it's like the benefit for me is that mental, like that's something I really enjoy. I know it's going to get like taken away pretty soon. And I'm like, want to just appreciate those last couple times that I get to do box jumps before the baby comes, so that's a piece of it too, for sure, is like we do this stuff, most of us, for fun and for our health and mental, physical well-being. So keeping those things in mind too, like I never want to scare anyone out of doing anything, but it's just taking all those things into consideration, and then making your decision about what movements you do and what ones you don't, maybe.
Yeah, I think probably the biggest one that people, right until the day I went into the hospital, I handstand walked and did handstand push-ups.
Yeah.
Mind you, I am and was very comfortable on my hands upside down before that. Like it didn't,
Yeah.
I
Right.
just started during my pregnancy. But that was when I thought would like go away or not feel good. And like when I got upside down, I felt so good.
Yeah. Well, it takes the
I
pressure off too, right? It probably takes some pressure
yes,
off your pelvic floor, and your
yep,
upper body's strong enough to hold you there. So it's like, yeah, great. I mean, lots of birthing specialists, that put you through some like these movements that you do going into labor will have you, not necessarily all the way upside down, but in
yep.
like a down dog, in a tripod sometimes, and so that's like, I know that like sounds crazy to a lot of people, but it's like, oh, actually, that's like, think about it anatomically, it kind of makes sense.
Yeah.
So, all right. Well, thank you so much for having me.
Yes, thank you. And take care and good luck in the last couple weeks of or 8 to 10 weeks of your pregnancy.
Yeah, thank you. All right.
All right. Have a great day.
Do.